And so welcome to the introduction for mental health and nutrition evening. This is literally a sort of 20-30 minute introduction to the webinar series that I'll be giving later on this month. And just, I'm sure your microphones are already muted, but just ensure that they're muted towards the end, and then we'll unmute everybody and we can have a wee chat about things. And you're welcome to ask me any questions that you might have. So what I think is really important to emphasise is that what I'm talking about tonight is a very small part of lifestyle medicine. And lifestyle medicine is a wonderful sort of holistic approach in some ways to complete well-being, not only mental health well-being, but complete. And what I find, however, is that nutrition is one of the things that we seem to not be comfortable addressing as health professionals. So I'm a nurse and I worked in psychiatry for many years, and I really struggled when it came to, well, what do we advise people around around nutrition, and what do I feel comfortable advising people? And so just a little bit of information, and I'm sure that these stats are probably nothing new to many of us. Psychological stress among adults has increased over time, and nearly 1 in 10 adults have experienced psychological distress in the last 4 weeks prior to the 2020-21 survey, and that's an increase from 7.5%. So that's just some Ministry of Health stats around psychological distress. So just a little bit about me. So I'm a registered nurse, and I've been working in the area of psychiatry for almost 25 years. And most of that's in frontline psychiatry. So I was a crisis nurse. I'm a dually authorised, I was a dually authorised officer, and I worked in South Auckland, and I spent a lot of time frontline doing acute psychiatry. And then I spent about 8 years or so doing psychiatric liaison work at Middlemore Hospital. And this was very much seeing the people that were coming into the emergency department with self-harm or suicide attempt, or even just acute anxiety. And so we would see these people, and we would often, provide them with some medication and some very brief sort of psychological intervention, and we would sort of send them out for what we would hope to be some follow-up. And what happened is that one day about 8 years ago, I was at work, and we were going through the morning handover, and what I sort of found was that we were discussing the patients that had come in overnight, and I noticed some very familiar names on the board, and these were the people that we often called the revolving door patients. These are the people that would often come in quite regularly, and we would sort of patch them up as well as we could, and we would send them out. And a lot of these people were suffering from depression and anxiety. And there was one day I was sort of sitting there, and I sort of sat there listening to the morning handover, and all of a sudden I just had this kind of, in some ways, a sinking feeling. I just sort of thought, what are we doing in psychiatry that we're not really getting people well? And what is it that we are struggling with? So we know that in psychiatry, there are two real models of treatment, and one of those is medication and the other is talk therapy. And medication can work incredibly well for people, and talk therapy can work incredibly well for people. And if we bring them together, then that even enhances efficacy of treatment with those two models. But I also knew that there was a lot of people that weren't responding to medications. And we were seeing a lot of people with 2 or 3 or sometimes 4 medications related to their psychiatric illness. And some of them didn't have access to talk therapy. Some of them just really struggled to engage because they were at such a level of distress that it was very hard for them to participate in talk therapy. So and we know, for example, that 60 to 70% of patients with depression respond to antidepressant therapy, which means that 30 to 40% of patients do not respond to antidepressant therapy. And in regards to anxiety disorders, we also know that SSRIs, so serotonin reuptake inhibitors, and cognitive behavioural therapy can work quite well with anxiety disorders. However, in that aspect, there's only about 60% of patients that respond to those treatments as well. So I was sitting there sort of in this morning meeting, with a sudden realization that, there's something we're missing, and there's something that we are not doing. These people are not getting well. So that day I left work thinking, I'm going to take a couple of weeks off. I really need to sort of just get my head together around all this. And what transpires is that I ended up having a year off completely from nursing. And what I decided to do in the end is actually I went traveling for 8 months, and I just sort of completely forgot about nursing and psychiatry. And then I started to think, well, eventually I'm going to have to come home and I need to make some decisions about what am I going to do. And I've got all this skill set, I'm a registered nurse. I've done DBT training and problem solving training, and I've got a master's in health science and advanced diploma in mental health. I've got all this skill set, and I actually do love psychiatry and I love working with people with mental health. But I think that there needs to be something more that I can bring to the people that are struggling with mental illness. So I really started to dig in, and I started to look at, well, what else are we actually missing? And what makes a real difference for people when they are struggling with anxiety or depression? What makes a difference? What helps to build resilience? What helps to keep them well? What supports them from having a relapse of their mental illness? And I speak mostly about depression and anxiety primarily because depression and anxiety are the most common mental health disorders. So these are the ones that we come across most often. And there is a little bit of information about schizophrenia and things as well, but primarily, most commonly, we deal with depression and anxiety. And I started to sort of look at all the factors that affect mental health and well-being. And we know that there are loads. Psychological factors impact, obviously, a lot. Adverse childhood experiences, repeated episodes of extremely stressful situations, people's ability to cope, their coping skills, their social support and loneliness impacts on depression a lot, actually. Physical health, chronic illness can impact a lot. We know that, lack of movement can impact mental health. So I started to really delve into the whole lifestyle factor of what actually contributes to mental illness or mental disease. And the other thing I sort of come across quite a lot was about unemployment and poverty and access to services. So there's this huge lot of different aspects that contribute to mental illness. But one of the things that kept coming out and coming back and kept hitting me was the amount of research around diet and nutrition and mental health. And I was sort of reading a lot of this research, and I was thinking, well, this is fascinating because I have been working in the industry in psychiatry for 15 years or so at that stage. And I have never been taught this, and I've never understood how diet might impact mental health and well-being. And is this something that we should be looking at as mental health professionals? And if so, what is it about diet and nutrition? And so what happened is that I was at a conference. So this was in 2016 or 17. I was at a conference in Melbourne. I had joined ACNEM, which is the Australasian College of Nutritional and Environmental Medicine. I joined AMA, which is Australasian Integrated Medicine Association. I was doing all sorts of online courses with Dr. Wheel in Arizona, and just basically anything I could get my hands on to learn as much as I could about what actually impacts on depression and anxiety and mental illness. Felice Jacker, who was in charge of this study, was giving her presentation about the SMILE study. And I don't even think at that stage that this had been published. And the SMILE study was a 12-week parallel group, single-blind, randomized controlled trial of an adjunctive dietary intervention in the treatment of moderate to severe depression. So what they did is they got 67 people, so it wasn't a huge study, but 67 people who were diagnosed as being moderately or severely depressed, and they used the MADRS score for that, and I'll talk about the MADRS score in a little bit. So they got 67 people, and what they did is they put half of them, as well as they could halve them, 33 people into an intervention, and 34 people were the control. And the intervention consisted of 7 individual nutritional counselling sessions delivered by a clinical dietitian. So what they did is they attended these nutritional sessions, and they were about implementing a modified Mediterranean diet, so changing their current diet to a modified Mediterranean diet. And the control group had social support for the same sort of length of time and the same sort of schedule. And what they found after 12 weeks is that the people who had the intervention, so the people who changed their diet from what they consider the SAD diet, which was really the standard Australian diet, to the modified Mediterranean diet, 32.3% of those people actually went into remission from their depression. So their MADRS score dropped below 10. And the number needed to treat, so the amount of people they needed to treat with this dietary change was 4. And so this is a MADRS score here. So they were originally in the moderate to severe category. And at the end of 12 weeks after changing their diet, they were in the mild and very mild, because it was 10 and under, to completely absent symptoms of depression. So I was sitting in this conference, and I remember thinking, well, this is huge. This is a huge result from what seems to be a relatively simple intervention. And we know, for example, that in some cases, antidepressants don't have as much efficacy as what this study has. And in some ways, the numbers needed to treat need to be much larger. So numbers needed to treat are around how many people need to be part of the intervention to get one person to respond. So the larger the number to treat, the poorer, I guess, the treatment is. So for tricyclic antidepressants, for example, the numbers needed to treat range from 7 to 16, and SSRIs from 7 to 8 number needed to treat. And for the SMILE study, it was 4. So I sort of thought, well, she's answered this amazing question that if I am suffering from depression and I change my diet or I improve my diet, will my mental health improve? And so she managed to put a study together to really show this. And I was quite blown away, and I thought, well, this completely, this can completely change how we view mental illness, and it can also completely change how we approach mental illness, especially in primary care. It's a perfect time to intervene with people and talk to them about what they're eating. But of course, we're 5 years down the track now, and I'm not sure if dietary intervention is something that primary care GPs always do. I know some do, but I know in psychiatry, we still don't actually really go into nutrition and diet with the people that we see. So I started to sort of also look at, well, what exactly is the impact of diet on mental health? What is it about what people are eating, and how is it impacting on their mental health and well-being? And are there common vitamin or mineral deficiencies in the mentally ill population? Like, were the people that were depressed, for example, struggling because they had a specific vitamin deficiency which was causing or contributing to their depression or their anxiety? And is that why when we changed their diet they had an improvement? And I was just starting to get very curious, like, what is it about diet? What makes a difference? And then I thought, well, if it is a vitamin deficiency, does taking a vitamin help? Does taking a vitamin actually make a difference for these people? and what else could be going on for them. Is it what they're eating? Is it what they're not eating? Is it about what else diet is doing to their body? So I really sort of just started delving in, and literally over the last 5 or so years, this is what I've been sort of incredibly passionate and curious about. How does diet impact? What is it about diet, and what makes a difference for people when they change their diet? What are the biggest factors? And I guess the other huge thing that I kept asking is, like, what can we as health professionals do? And for me as a nurse, I was very aware of stepping outside of my boundaries, and because I'm sort of careful about treading on the dietitian's toes, for example. So I started to think, well, what can we do, and what sort of dietary advice can we give people, and ensure that it's researched, evidence-based practice, that we're talking to people about evidence-based practice if we're going to advise people about nutrition or vitamins or supplements. So what this webinar series is about is really, it's gathering all this research and information that I have learned over the past 5 years and bringing it in a 2-part webinar, which I expect and I hope that you will really understand and get, and also then at the end of it feel super comfortable about what you can advise people who are struggling with mental health issues, what things might be helpful for them to try, and even just to talk to them with enough confidence to say, for example, the SMILE study, and I often say this to people, there are people that have been diagnosed as depressed, and what they found is that for some people, when they change their diet, their mood actually improved. And for some people, they are willing to do that. I mean, it depends on the individual, but for some people, they are totally willing to do that in order for them to feel better. So in part 1 of the webinar series, we look at the association between diet and mental health and mental illness. So we really look at the research. What does the research say about diet and mental health? And then we also look at the research around what other studies have shown, apart from the SMILE study, that if I change my diet, my symptoms might improve. These are some of the things that we look at. We look at the different sorts of fats in diets, trans fats, omega-6 versus omega-3, what difference that makes, and then what happens if we provide supplementation for some of that. We also look at things like immune responses to gluten and its association with mental illness, and also immune responses to dairy. So these are immunoglobulin A and G responses to these two things. And we also look at the overall impact of the junk food diet and what the research says about a junk food diet. We also look at mental illness as a disease of inflammation, because we know that people who are depressed or anxious generally have higher levels of CRP and cytokine. So we look at how diet, because there is such thing as an anti-inflammatory diet and a pro-inflammatory diet, and how diet is associated with increased inflammation, which can then also be associated with increased mental disease. We also look at, well, what is a healthy diet? And we compare the modified Mediterranean diet, which is what was used in the SMILE study, to what our current guidelines are. So on the left here are our current Ministry of Health guidelines. So if you've still got the image of the pyramid in your head, that's well and truly gone. These guidelines were released in December 21, and these are the current guidelines. So we take a wee look at all those as well. In part 2, which is on the 22nd of June, we will look at vitamins and mineral deficiencies in the mentally ill, and that's quite significant actually. What they look at people that are in a psychiatric hospital, for example, and look at the common nutritional or vitamin deficiencies that these people experience, and also whether supplements actually help, and also what else is important when it comes to nutritional vitamin deficiencies. So we also look at the potential mechanisms, like why might a vitamin or mineral deficiency actually impact on mental health and well-being? What is it about vitamin and minerals that impact on levels of neurotransmitters, for example? And there's quite a bit of sort of information around that as well. And we also look at the influence of supplementary vitamins and minerals, and also essential fatty acids like omega-3s on health well-being. And underneath the writing here, you'll see that there was it's an amazing study that was published in 2002 looking at the influence of supplementary vitamins, minerals, and fatty acids on the antisocial behaviour of prisoners. An incredible study that actually shows what a positive response some people have towards increased vitamins, minerals, and omega-3s in their diet. We also took a little look at blood levels and actually looking at what is a normal blood range, and just because it's within reference range, is that actually enough for somebody? And so we sort of dive into what would be an optimum reference range for people, and try and find some data around mental health and wellbeing and optimum levels as well, which is not actually easy to find. And also looking at what's in New Zealand, sort of looking at what are the average levels and what are the deficiencies in New Zealand specifically. We also look at some of the latest research. So this was published in 2022, and this was looking at nutraceuticals, which is things like vitamins and minerals, and phytoceuticals. So this is looking at plants, herbs, for example, that have an impact on mental health and well-being. So as I said before, nutrition is a small part, but I do think it's a really important part. And I think as health professionals, it's something that I certainly wasn't taught about. And we often sort of miss when we do an assessment, when we're asking people about how they're feeling and how they're sleeping. And we might ask about their appetite, for example, but we don't really dive in and say, well, what exactly are you eating? What is your diet like? So my hope is that we can really start a conversation about this, that we can start to talk to the people that we work with, the people that are suffering from mental health and real mental health issues, but also talk amongst ourselves and talk to our colleagues about, well, actually, I have heard that what people eat can make a huge difference, and actually sharing that information with colleagues so that they also can feel confident with information around diet and mental health. And I guess one of the other things I think it's important is, we've got these wonderful two therapies of talk therapy and medication, but I think I really would love to encourage people to think outside the square when it comes to treatment of mental illness. So the Lunchtime webinar series happens on June the 15th and the 22nd, and it is from midday till about 1:30 p.m. This is just how to, if you're interested in purchasing, how to go about that. And I have put an early bird discount, and you can get 20% off until the 3rd of June. So using the MH20. And that is mostly it, I think. So I'll stop the screen share, and happy to have a chat with people if anybody's got any questions or anything that they wanted to ask or say about all that information that they've just heard. You are welcome. So just to let you know, the sessions that will be coming up, they will also be recorded, and you will have access to those if you are unable to attend on that day, or if you get called away. So I imagine that's the other thing, is that you don't have an hour and a half during the day. So they will be recorded and sent to you if you want to participate. Does anybody have any questions at all?
I have one for you, Helen.
Yes. Hi, Becky.
Not a tricky one. I just wondered if you had delved into over the last 5 years, at all delved into patients who are suffering from postnatal psychosis or anything in that realm.
Yeah, I haven't done a lot on postnatal, but I know that there is significant research coming out about postnatal depletion, what they call postnatal depletion, and that some of the illnesses that women are suffering from are actually from nutrient deficiencies from obviously growing a child. So that is something I haven't delved into a lot of that research, but yeah, that is something that I think is becoming increasingly evident, that that's a real issue.
Cool. Yeah.
Yeah,
Okay.
that's right. Anybody got anything else they wanted to ask? And actually, if everybody's comfortable, you're welcome to just put in the chat what you do in the way of, are you a nurse? Are you doctor, or just an interested person? And if you were an interested person, I hope it wasn't too over the top for you. Because I know that some other language that we use can be quite challenging to understand.
You did mention I'm a practice nurse, a GP practice in Tauranga. You did mention the is it kinase levels?
No, cytokine. So cytokine and CRP. So CRP, obviously, microinflammation, and increased inflammation seems to be associated with mental illness, or at least depression and anxiety.
Okay, because I see that, often on the blood tests that the GPs ordered, and always wondered what significance that is. Really, I've never had a good discussion about that. So, what are they looking for, or what would you be looking for?
So, I mean, the CRP is generally inflammation in the body. So where is there inflammation? And that's a very broad definition, because it can be anything from they twisted their ankle to overall body inflammatory disorders. So it's a bit of a tricky one to pinpoint, but I guess it gives an overall idea of what might be going on, or that there is something not quite right going on for that individual. Yeah. Anything else that anybody wanted to ask? And if we're all good, I will let you all go and carry on with your evening. And I thank you very much for joining me. I very much appreciate that. And I hope that you found it interesting. And I would love to see you in a few weeks on the Nutrition and Mental Health webinar series. And feel free to send it to colleagues. And I certainly don't mind if a whole group of you join and you share that information, because my biggest wish really is that this information gets shared and that people really start to think about how nutrition might be impacting people with mental illness.
That was a brilliant introduction. Thank you, Helen. I'll look forward to attending the 2 webinars, definitely. And I've already got some other interest at my GP practice, so that's brilliant.
Fantastic. Thank you, Vicky. Much appreciated. All right. Okay, have a lovely evening, everybody. Feel free to contact me also. If you've got any questions, feel free to email me, and hopefully see you all soon.
Thank you.
Bye-bye.
Bye.